The susceptible patients like CKD who have diabetes and who have chronic liver disease or who have HIV and who are on immunosuppressive medicines, they are at high risk of tuberculosis infection. But in those cases, usually we check for latent TB infection that we have discussed. The TB bacteria is in sleeping phase or latent phase. So we check for latent TB infection by doing MON2 test. It is a tuberculin skin test. By injecting a liquid under your skin, we check the swelling after 2 to 3 days of giving injection, and based on the size of the induration or size of the swelling, we comment on the positivity of the test. If the test is positive, definitely you have been exposed to the tuberculosis infection, tuberculosis bacteria at some point of your life. And one more blood test is there, that is interferon gamma release assay, IGRA, and by doing this test also we can diagnose the latent TB infection. So in the immunocompromised patients who are at high risk of developing disease, we look for latent TB infection and we treat the latent TB infection so that we can prevent the converting the latent TB infection to the dangerous TB disease. So who are at high risk, you can meet your pulmonologist and do checkup for latent TB infection. And definitely the concerned person should follow the preventive measures. Means when he is exposed or he is around the TB patient or who have been coughing a lot, increase the awareness of that person to wear a mask. Otherwise you wear a mask covering the nose and mouth, and definitely this mask prevents the transmission of infection.